an important takeaway that I want for people is to be savvy probiotic consumers. The nutraceutical companies it's a bit of the Wild West in terms of you can say that it has, like you can say that a probiotic product has, 50 billion like lactoacidophilus and bifidobacterium strains, but not all the strains survive the acid of your stomach. And in order for them to be effective, it has to get into your small intestine and then to your large intestine. And so there's certain companies that will have little numbers after their probiotic name. So it'll say like bifidobacterium CDX390 or whatever. And so those probiotics are telling you what specific strain, not just the bifidobacterium strain, but the specific bacteria strain that's in there, and you can research it and see if that one survives the acidity of your stomach. And so that way you don't have $70 bowel movements because you've taken these probiotics, but they all just die in the stomach acid and then they go off. And so that for me is something that's really, really important. One specific thing is that they're just learning. It's sort of like a new wave of medicine in that, they're learning what specific strains do what in regards to anxiety, in regards to gut health and immune health. Like whether it's one's better for diarrhea, if another one's better for constipation. So, but celiacs specifically tend to be low in bifidobacterium. And so that's one that's really important to look for people with celiac disease. There's another product, it's called GI Revive Powder, and it has high doses of glutamine, aloe, mallow, and that is very soothing to an irritated gut. Collagen is helpful for gut healing. Chinese herbs, again, this is something that's based on an individual and based on what their constitution is. So different herbs and different formulas are going to be effective for different people. And then I just got exposed to these phototherapy patches that are really, really cool. And I give them for patients to use at home over different acupuncture points. And so it's a way for them to kind of carry over in between treatments. And it uses your own body's heat that reflects back that wavelength to help stimulate the cells and to have different responses. And so the glutathione helps with detox. The ion patches can help. They're like antioxidant and relieve stress. The EE is for energy enhancers. And so those help to kind of more tonify and warming the system. It's very similar to like a red laser. And the IW, those are ice waves. And so those are akin to the same resonance as a blue laser. And so those are things that people can use at home and over acupuncture points to help relieve their pain and their symptoms. And if anyone has questions, I can definitely give like specific point recommendations about that. One of the things that tends to get missed for people with celiac disease are oats, because they're like, oh, gluten-free oats. But it's a very similar protein structure. And so that can oftentimes irritate people who have celiac. And so I oftentimes will recommend to them to, if they're still eating oats, to cut out oats if they're still symptomatic. And then the Mrt testing, that's mediator release testing. So it's a blood work test that the LCAT test is really common and covered by insurance. And the same inventor of that created the MRT. It's like a more evolved version of it. And so what that does is that it takes your blood. So it's a one moment in time. So, blood work is important, but it's also important to remember that here's a snapshot of what's happening right now. And so what the MRT test will do is it'll test your blood against a variety of foods and supplements. And it depends on like what kind of package you get with it, and food additives and spices and all that stuff, and looks for byproducts of inflammation. So, it's not just, okay, you have a specific, because there's different kinds of allergic reactions. There isn't just like one way, and especially for autoimmune disease, which is different than an allergic reaction. And so, like, so for example, like my son who has celiac disease, his blood work shows that he's not allergic to wheat, but he has celiac. So there's no way that that kid can have gluten. So this particular test, the Mrt test, you can get, and it looks at the byproducts of inflammation, and it ranks the foods into like red foods, yellow foods, and green foods. And so like the red foods you want to abstain from for 6 months. The yellow foods you want to abstain from for 3 months. And then it kind of gives you a guided elimination diet. So versus just, it's much more individualized. And then you can start bringing these food back, like the food back over a period of time. And usually for people when like they have these food allergy tests and they're allergic to like everything, or they're reactive to everything, once you give your body a break and can reduce that inflammation load and all those triggers for a good amount of time, you can start bringing a lot of those foods back. And what you'll find is that maybe there's really just 3 foods that you need to avoid, not 15. And so that really improves your quality of life, because you're able to go out and eat more foods versus just, having like chicken broth at a restaurant without the noodles. But with celiac, you couldn't have it that way anyways if they made it together.